Really honored and delighted to be here today. And I love you again. I was here in 2014, 2016. I was a scholar with a health spirit research training program, and I learned a lot. I'm going to talk to you today. I'm not going to talk about biology. I'm going to talk about disparities because we have a huge problem living in Macon County and the surrounding county. You'll see a lot of, gap. There is lack of health care services and facilities. People, they don't know even what cervical cancer is. Imagine a woman, she doesn't even know what cervix. It's really, and that's not far. That was like 2 months ago. We heavily had a lot of workshops in Macon, Barbara County, Lowndes County, and Bullock County as well. This is the 4th county I focus right now, but we are planning to move forward to the whole 12 or 18 counties. So huge, huge disparities. And not only Black facing disparities, white also are facing disparities. But living in Alabama, you will face disparities because there is lack of health care services and facilities. Of course, race is playing also big role in disparities. But again, whoever living in Alabama, they will really suffer some kind of disparities. So, an estimated 19,200 women and 11,600 men are diagnosed with HPV post cancer each year in the United States. This is huge. With cervical cancer being the most common, forcing female. Disparities in underserved communities are concerning with incidence and death rate higher among Black, low-income, rural women, particularly in southern USA. Alabama ranks 15 nationally in HPV cancer rates with 66.7% and 80.8% of counties having higher HPV cancer rate than the national incidence among male and female respectively. So Alabama has more than 1,000 cases of HPV-associated cancer annually. Alabama ranked 1st in deaths and 3rd in rates of cervical cancer, 5th in rates and 7th in deaths in oropharyngeal cancer. When we compare Alabama with the whole United States, Alabama by itself is higher than the whole United States. This is really alarming. We have to really dig deep to see why. Despite the screening rate in Alabama is higher. When I start this project, my hypothesis was that the screening rate is low because living in Macon County, looking at no transportation, no public transportation in Macon County. If your car is broken, you have to ask a friend to give you a ride. Imagine our senior citizens, what they will do if they have to go for the treatment, or even if they have to go for the screening or follow-up. No transportation, gas is very expensive, a lot of disparities there, a lot of huge problems there. So people living there, they cannot go to get their treatment. They cannot, there is only 2 healthcare facilities there. They offer pap tests, but no treatment. No treatment. So this is really, it was really alarming to us. And then we planned from there, what's the reason? Because in epidemiology, if your screening is high, mortality should be low because cervical cancer can be treated, can be prevented if you find about it in the early stages. So screening high, find about the problem, treat it. But the opposite here, the mortality even more than triple among Black compared to white. So the most common sexually transmitted disease, as you know, HPV, currently affected nearly 8 million people in the United States. HPV-associated cancer remains a public health problem. It is a real big public health problem. From 2019 to 2020, this is the most recent data for Alabama. Approximately 79 million Americans, most in their late teens and early 20s, are infected with HPV. Each year, about 14 million people become newly infected, most of them teens and young adults. So this graph shows here, there is many risk factors. One cause, HPV, and many risk factors. More than 16 out of every 100,000 women ages 40 to 44 get cervical cancer. Versus if you look to young people, fewer than 2 out of every 100,000 women ages 20 to 24 get cervical cancer each year. That means age matter. When you get older, your risk is really high. You are more likely to get the disease. Of course, you have to get the HPV first, and then this is other risk factor can increase your problem. So here, this is the incidence rate. Cervical cancer incidence rate in Alabama is 9.0, significantly higher than the United States, 7.5 per 100,000 population for women population. So if you look to Black here, Black females in the state have significantly higher cervical cancer incidence rate than white. 10 point, this is the blue one, show the graph, 10.2 versus 8.7. Again, the incidence rate is higher, despite that the screening rate also higher among Black. The screening rate among Black is 85% versus 77% among white. So here there is gap, something is wrong here. Mortality rate is 7.8, it's also higher than the United States. Alabama by itself is higher than the whole United States in the mortality rate regarding cervical cancer. Blacks, also the mortality rate among Black is higher than white, 4.8 versus 2.9. Again, despite the high screening rate among Black. So between 2014 to 2018, percentage change from cervical cancer incidence rate is about decreased by 11%. Not huge decrease, just a little bit. The same thing with the mortality rate. Maybe because of what people doing, I'm sure UA people that are doing a lot of work at the Tuskegee University who are doing a lot of work, maybe that's why it just reduces a little bit. But again, a lot of things has to be done. Working with the community is not an easy. Especially county like Macon County, because our people suffered before. You remember about the syphilis study? Till today, people that are suffering, till today, they will not come. We try our best working with them, but they will tell you, they were even crying, telling you that we don't know what you're going to do with us. We're trying very hard. And I'm so glad, on last 2 weeks, we had our last workshop, for the cycle, actually the grand cycle. That was the first time we knew the woman came out. We were dancing that time. We never saw that. We have over 200 women come to one workshop. That never happened before. So I think now they start to get, that is very important. They start to trust us. And that was not easy. We built that, the first thing we started, we were working with the school system, we were working with their kids. We were heavily working with the kids, during the week, we go twice a day. We help the kids with their homework, because we saw that when someone trusts you with your baby, they will trust you for everything else. That's what we started. But today we are so proud that we got this, and they call us, they requested, some of them, they say, I couldn't make it that day because I had doctor appointments. I need you to come back. So now we plan to do like a small session with them to collect more data. So that was the thing, it was really great. In fact, every year in the United States, about 12,000 women get cervical cancer and almost 4,000 women die from it. Some people, they may see that a lot, but for cancer that is prevented, it can be prevented. We should not lose no woman because of cervical cancer. In 2021, an estimated 250 new cases. That was 2021. And again, we don't have the updated data. The most updated data is 2021. So 250 new cases of cervical cancer are expected to occur in Alabama. We will get the news about this soon. Cervical cancer should not happen. This cancer is ultimately preventable and highly curable, as I mentioned. This table, just I want to show you, this is very updated. I just got it last night. Screening up-to-date Pap test, HPV test, women 20 to 65 years old. That was back in 2020, sorry. In Alabama, 68%, US, 87%. You see, the difference is what? Just 1%. And again, nationally, it's ranked number 33, Alabama, in terms of screening. Screening should start at age 25. People under age 25 should not be tested because cervical cancer is rare in this age group. Trust me, when we had one of our workshops that back in 2018, we had 9 women, their age is less than 25, they have cervical cancer. We were shocked to see that. And when we look at the surveys, they don't know nothing about it. Well, they're very young. So people between the ages of 25 and 65 should get a primary HPV test, then every 5 years. If a primary HPV test is not available, and in most of the countries not available, so they can get the co-test, which is HPV with Pap test. And it should be also every 5 years. Or a Pap test every 3 years are still good option. The most important thing to remember is to get screened regularly, no matter which test you get. Screening is very important. People over 65 who had regular cervical cancer testing in the past 10 years with normal results should not be tested for cervical cancer. Once testing is stopped, it should not be started again. Those with a history of serious cervical cancer should continue to be tested at least 25 years after the diagnosis with that, even if this testing goes past age 65. They should keep testing because you never know. It may come back, and it happens. People whose cervix has been removed by surgery for reason not related to cervical cancer or serious precancer should not be tested. Because for any other reason, sometimes because of accident or any other reason, they should not be tested. People who have been vaccinated against HPV should still follow the screening recommendations for the age group. Of course, some individuals, because of their health history, like HIV, we just talked about that, and HIV can put you at risk. If you are HIV positive and there is HPV in your system, first of all, the RT treatment is not going to work well. Your CD4 will never increase. It will be below 200. So I remember 3 years ago, when we find there is 2 papers or 3 papers, they spoke about this problem, but the sample size for the data was very less, like 32 people. And they asked for validation of their research. I love that story. And I immediately contact medical advocacy outreach because there is a lot of cases, patient of HIV patient, they go there from different Black Belt counties. So we went there, we had meeting with them, and they don't even know about that. They were so excited to hear the news. They said, do you really do any pap smear or HPV testing? They said, patients, they don't like it. I said, because you do not tell them the truth. If you tell them your life at risk, you won't be treated from HPV. At the same time, you will be 15 times more likely to get cervical cancer. So we agree that to work together because they do have 1,900 patients. Actually, 30 of them are female, but we plan to work with both male and female. So, and then we signed, we do have the RB and everything, and now we're going to start together to work together. Because, you know, that the population, you imagine how many people there. Remember, I said the sample size from the previous study says 32 people. Now I have a lot of people, I'm going to validate their study. And what the beauty of that, because they're going to provide me the information like CD4, viral load, the treatment, all the information I needed, I will get it from there. So that's why we plan to really work and validate the previous study. So some individual, because of, I said, HBV, organ transplant, diacylcholesterol, also the birth control, and also put you at risk because this is also other risk factor. May need different screening schedule for cervical cancer. In this case, you know, people, they need to go to their provider and they will help them that if they want to do it, they want to continue or whatever the recommendations for that. This map actually I developed myself for my PhD work because I also did majoring in geographic information system. In that time where we combined the computational epidemiology with geographic information system. And the reason we have done that, actually the data we got it from cancer registry. And if you look to the whole blood bank counties, it's very, very, some of them there is no record. And to do only statistical analysis, you are not going to see any significant. That's why we plan to do risk analysis, quantitative risk analysis. The beauty of risk analysis is that you will be able to do your work, even if you have less information, less data. You can still do that, even with the geographic information system. That's why we combine both tools, and we're able to come with some results. So here, this is if you see the blue, actually the data we got, it was categorized into order, like other rural counties, rural blood bank counties, because before Montgomery County, they consider as a blood bank county, but it is not like Macon County. That's why the new category that they put Montgomery with other rural counties. Macon County is the other black rural county, but Montgomery is other rural county because they are better than Macon County and Bullock County, Barbara County, and other counties. And of course, urban county. So this data here showing the incidence, and I really put, you know, Macon County. It's really embarrassing to see Macon County as the top, 20% among the whole counties. Some counties there is no record. They say that the data fewer than 15 cases they could not be. Trust me, this is not the truth. Because when we went there, we start now collecting data. We have a lot of numbers. So Macon County is still the highest. We discussed that seriously when we saw that. And that's why, you know, we heavily now, you know, since 2002, 2003, we have 7 workshops. Just working with them, you know, talk to them all the time, even during COVID. We start teaching them the basic technology. Because I remember when COVID hit, you know, we all became disabled. We don't know what to do. Imagine people living like in Macon County. They don't have even a smartphone. They were totally disconnected from, you know, getting the information. We figured out that we need to teach them the basic technology because smartphones, some of them, they are very cheap, but again, they can do the work. And now in my new grant, now we plan to even buy some cell phone. We would budget for that. We have 4 counties, we're going to provide them with cell phone. And we're going to train them how to use it. And those they need internet, we can also provide some money for that. There is a lot of sadness if you go there and see, and they don't even have the phone. So maybe that's going to help us. Now, actually, we collected the data, and I told you it's new data. We have almost about 300. Actually, when I calculated the sample size for my study, it's 377. That should give me good results. And now I am more than that. I'm sure it's going to be very good, result. We will see more. This is also regarding the screening. If you see in Alabama, 85.5%. This is among Black and white, 79%. But the incidence rate is higher among Black compared to white, despite high skin, as I mentioned earlier. Look at United States, 84.8 among Black here in the United States and 80.1 white. Again, the same thing. The same problem. Human papillomavirus vaccine. Since 2006, 3 vaccines, Gardasil 9, and Cervical, where FDA licensed and recommended the 3-dose series. This is from beginning, but now down to 2 doses. If the first dose, they took it before their 15th birthday, so they take just 2. If after, then you have to take 3 doses. And only Gardasil 9 now it's available now. Although this change has promised to increase vaccine series completion, turning rate for adolescents completing the vaccine series fall far short of the healthy people 2020, which is 80%, and even healthy people 2030, they kept the same goal, which is 8%. And you can see now, I'll show you the graph after this slide. You will see how far, especially Macon County and other counties from the goal. So HPV vaccination covering boys aged 13 to 17 years. This is in 2020, in Alabama 49%, US 56%, and the national rank is 39%. This is for Alabama. This is for boys. For girls, 57 in Alabama, 62 in US, and again, national rank is 36. It is really, we have to work hard to increase this, because this is what's really disturbing. The vaccine is for free. There is a program called, maybe you hear about it, Vaccine for Children program, which is offer a lot of vaccines. One of them is HPV for children from age 11 until age 18. It is for free. I investigated, I went myself, I interviewed many of our healthcare providers. I found there is 3 facilities in Macon County, they offer the vaccine for free. I asked, I said, do you have data? They said, people, they don't come to bring their children, and it just expired and throw it away. What? Therefore, now we are campaigning. We established something we call Check Yourself campaign since 2021. We focus working with the children, which is grade 7 and over their age. Before we said until age 24, but now we really extend it over because Tuskegee University, our college students working with them as well. We are really working hard to let them know the vaccine is there. It is for free. So, and this is going to be our new brand. We focus heavily on that. Also, Alabama Family Planning, they also offer vaccines for female, which is from age 19 and older. So they cover the gap here, because vaccine for children from 11 to 18, 19 and older, they can again get for free. But the kids should be underinsured, and of course, or in Macon County, all this, they are underinsured and they don't have really good coverage for their health. So the vaccine is there, the vaccine is for free. So Alabama counties have a HPV vaccination rate less than the national average. HPV vaccination rate among children 11 to 15 ranked from 10% in Clark County to 44% in Bullock County. And I will tell you about Bullock County. I'm not wondering. Yeah, it is even far from the goal, which is 80%, but is one of the best counties. Whenever I go to Bullock County, a lot of people come, they listen versus other counties. And I let them know. I remember we were there 2 months ago, and we told them that you are doing better than others because you should let them know. And they were so happy to hear that. So I assuming next time we're going back, I assuming that we're gonna get even more people. You know, I'm sure the vaccine rate is going to change. You will see better because they are really, something is going there. We don't know, we are investigating to see. Barbara and Bullock County very close. Barbara is doing very bad. So also HPV vaccination rates among children 11 to 15 in Macon County is 27%. I'm not wondering. Because, and the stigma, it's really disturbing. It's still people that have the stigma and fear of syphilis study. It's not easy to get them out of that, you know, mentality. But again, as I mentioned, we are so happy to see them come and listen to us and come to us. They come to us in Tuskegee, and even, you know, we told them, we said, if you need us, because I remember back in 2014, we had our research symposium. We invited healthcare people from the Macon County Health Department. I remember we invited the nurse. She came there, and I asked her a question. I said, the mortality rate is more than triple in Black versus white in Macon County, despite high screening rate. Why is that? She said, because doctors sometimes did not tell them they have cervical cancer. Well, we said, this is illegal. And nurse, she was telling us that. And we really start to believe that, because when you see, you know, people dying from cervical cancer, and unfortunately, when we had our first workshop in Macon County was like 4 months ago. One woman, she had cervical cancer, and she came to me, she was asking, because we have some medical doctor, we brought them, they were helping them, they were talking to them, and she doesn't know a lot of things, but before, actually, when we invite her again to the next one, she already passed away. Even I remember her incentive, we have to give it to her daughter. So that was very sad. She was really young, she was in her 40s. So 27%, that's really bad. That's why we now working very hard with them to change this picture. It has to change. Because we at Tuskegee University, we feel ashamed to see this data. You know, you don't know unless you see data. So the state average of 20% lag behind the national average of 49%. Future work is needed, as I mentioned, to really translate this finding into actionable intervention practices. That's what we plan to do now, to increase HPV vaccination, to reach to healthy people 2030 goal that intends to increase proportion of the listeners who receive the recommended doses of HPV vaccine to 8%, hopefully. This is just to show you, Bullock County is the highest, and Macon County is just 20%. Russell County is 13%. This is the least. I just want to share, this is the same map I showed you before. This is also part of my PhD work. Actually here, what we're planning to do. I read an article saying that for cancer patients to get treatment, they're supposed not to travel more than 12 miles to get help. I just thought about it. I said, living in Macon County, only 2 healthcare facilities, they provide HPV, pap smear HPV test, no treatment. That means our patient has to go either to go to Montgomery or go to Columbus or come to Birmingham. How many miles? It's just 12 miles. So I immediately, when we developed this map, I was able to just, there is a way tool, you can just get Macon County, and then I did buffering, which is, you see, 10 miles away, 20 miles, 30 miles. And then before that, what I did actually, I contacted about 40 healthcare facility and services. We just got the address, their phone number from Alabama Department of Public Health. I call them because if I go to the internet, sometimes some of them out of business, but still their information there. So I call them and I ask them, do you offer pap smear and treatment? So I categorize them, those they offer pap smear and HPV testing treatment, and those they did not offer treatment. And then based on that, I offer everything to see how far. Okay. I did not put the whole things, but after buffering, we find only 2 healthcare facilities located in Macon County. They are just 9 miles from downtown Tuskegee. That means ideal because they said 12 miles, but none of them provide treatment. Now they have to go, no hospital, by the way, no hospital in Tuskegee. Macon County, we don't have any hospital. No even urgent care. So that means these people, they have to travel too far to get their treatment. Imagine without no public transportation. And for cancer, you have to go for your chemo. You have to keep your appointment. Even after the treatment, you have to go back again to make sure you are cancer free. But they cannot do that because they cannot offer to go there. I just want to share some of our work that we work here with the middle school. That was also about HPV. I can tell you that day, some of kids, they were talking to each other after they told them about the risk factors. One of them, they say, I do whatever the doctor said, do not do. You see how, and I don't know, because sometimes in the school, you have to be very careful when you disseminate the information. So it took us forever to get the permission to work with these kids. And we find out they need it. They told us we need it. Come back. They will tell you, come back, please come back. This is in Lowndes County, one of the poorest county ever I have seen. This is what we have done. 2022, we have done a lot of workshops. This is Mayor Haygood, actually is our mayor. He's really helping us a lot. He comes in each and every workshop. He works with us. He talks to the participants. You need to work with Tuskegee University. He is really amazing. We really appreciate him. He's always there. Church. You see, we have Alabama Department of Public Health. We have a school system. We have a lot of partners. We are growing. Every day we are growing. This is another one. And here, this is, also we have some partner with some organization and some groups, which is Macon Means Cancer Support Group. They're doing a lot of work with us. We have also, as I mentioned, medical advocacy outreach now, Alabama Department of Public Health, churches, school systems. Every day we're growing, we became really big, and we really love that because, getting all this together, remember, together we can do a lot. As a team, we can do a lot, especially working with the community. So this is what I told you before about Check Yourself campaign that was established 2020. Our goal is to increase knowledge of human papillomavirus, HPV-related cancer, and the vaccine among young men and women from 7th grade through college in Macon County, Alabama. Usually, we have 2 categories. We have Scholar Leader Program, which is this campaign is seeking students who will serve as a leader among their peers to help increase awareness of HPV through peer-to-peer communication. And also we have the student leader, this is from Tuskegee also, and it's really worked very well. This is just some picture of the event, and you see this, the one here, this is our mayor again. He's very supportive, he's always there. And this is next to him is Dr. Diva Badi, she's our transitional PI of the whole grant. If you know about Dr. Yates, he was, but he moved to another institute. But he's working with us like 20%. But so here, this is some people from churches. They just help, we train them. They help the community with their survey, if they need help. This is our city commissioner, Mr. Maxwell, who is also very supportive. He worked with us. He talked to the participants to just attend this kind of event. This is a quiz, actually, I find it online. Actually, before that, we developed our own application. It's going to be out soon. We designed it the way that if we are conducting any cervical cancer, all the surveys will be through that. It's compatible with a cell phone. That would be going to provide some of our community personnel with a cell phone. And there is a lot of educational material there based on age. There is also games. The application was built with different games that, because we know young people, they love games and this kind of things. So it's going to be out soon. And the name is Protect Yourself from HPV. But I find this quiz, and actually I asked some of my colleagues to just take the quiz to see, trust me, the first one she took, she got 5 out of 7. She said, oh my God, sometimes you think that but trust me, a lot of things you don't know. Even though, I imagine this is not the community even people, this is people, the college people here. But, that's what I'm saying, simple thing. But again, even college people, they don't know even about it. So I think we are not, and then after this, we plan even to work with our college students. We plan to do also survey with them. We plan to educate them also about HPV, because Macon County is one of the counties, they have a lot of HIV cases, sorry. So that's why we plan to work also with our college students. When we saw this, quiz. So the last thing I think is just I'm so excited, actually, Dr. Iskaranichi, we just discussed earlier. She contacted us. Actually, I know her when I was a scholar here. She trained me. And after the workshop, she sent me an email and she said she heard about what we have done. And since we have one goal, so she said we have to work together, because now they are campaigning to eliminate. Before we say reduce, now to eliminate, wipe out the cervical cancer. So we had a Zoom meeting, very nice meeting, along with Dr. Heather White, who had to hear for health, which is to get her for health with a nonprofit organization. We plan to work together. And actually, I was so excited because I have one of my publications that back 2020, they're going to put it with that. So I was so excited. I want to share this news with you. And again, thank you so much for coming. Thank you for listening to the presentation. I'm looking forward to work with you. I saw a lot of people working in HPV, and I invited you to come to Tuskegee as well. So, and you come to Macon County, we'll invite you to one of our workshops to come and see, and I saw a lot of UAP people, they come there from also Auburn University, because Macon County, there is a lot of work. It can be done together. We can do it. Alone, we cannot do it. Remember, together we can do a lot.